Hello all, in this video we are going to discuss about indicators related to filarial disease and its control. We all know filariasis is transmitted by the Culex species of mosquito, and we have several indicators for the identification of disease incidence, prevalence and its control. We can use these indicators for checking the effectiveness of adequate control measures of the disease. We have classified the indicators of filaria into three types, that is parasitological indicators, clinical indicators, entomological indicators. Out of these three, the parasitological indicators are the most important, which will be used for your problems in community medicine. So we will focus only on this. Before focusing on the parasitological indicators of the disease, it is good to know about clinical indicators also. In filariasis, the acute symptoms of the filariasis is adenolymphadenitis and epidemic, and the presence of these two symptoms indicates the acute disease that it helps in identifying the incidence of the disease. So if these two symptoms are there, we can easily identify the incidence of the disease, and the chronic symptoms such as lymphedema, chyluria, hydrocele, and elephantiasis helps us in identification of the prevalence of the disease. The entomological indicators such as the vector density and the mosquitoes positives for larva. The density can be measured by man catch hours and man bite hours. So we can use those indicators for vector density, and for mosquito positivity, if we examine, the denominator will be Culex mosquitoes examined, and the numerator will be the presence of the filarial agent in the mosquito for mosquito positive for larvae. Now, as I told earlier, this clinical and entomological indicators are just for completions. They are not of routinely used, and most probably these indicators you have to know, but the chance of those indicators coming in the exams is very less. And these parasitological indicators are most commonly used and also has a high probability of getting these indicators in exams. First is the microfilarial rate. Second parasitological indicator is the filarial endemicity rate. Third is the filarial disease rate. Here we have to note the fact that all the denominators of indicators are number of people examined. So number of people examined in all the three indicators, that is MF rate, filarial endemicity rate, and number of persons examined. That will be the denominator. And all the parameters have the multiplication factor as 100. So you don't have to confuse. So all the parameters have the same denominator and the same multiplication factor. Then the numerator, we all have to understand the fact that all the disease rates are named based on the numerators only. So we have to remember the denominators only. So the denominator here is number of people examined into 100, and the multiplication factor is 100. So the numerator for microfilaria, number of individuals carrying microfilaria in the peripheral blood is called as microfilaria. And this microfilaria, we take 20 cubic millimeter blood through a capillary prick. We take that to between 8:30 to 12 p.m. and that is approximately 0.02. We take and we place a glass slide above it, and we make a thick smear out of it. Then we dry. Then the next day we dehemoglobinize. And then we look at the high power and we follow it all over the slide, and we identify the presence of microfilaria in the peripheral thick blood smear. That is called as microfilaria testing. There are so many alternatives to this microfilaria that currently there is a test called CFA, that is circulatory filarial antigen. So it is similar to microfilaria, but the procedure of taking the blood also remains. The sensitivity is high. Even when the capillary load of the microfilaria is less, it is able to identify the microfilaria. Currently, this circulating filarial antigen test, similar to this microfilaria, is also routinely used, and we have membrane filtration techniques also. So these are all additional techniques instead of microfilaria identification in the blood. But for epidemiological purpose, we need to identify the fact that microfilaria rate, the numerator is number of individuals carrying the microfilaria in the peripheral blood. As I told earlier, this will be done during the night, 8:30 to 12 p.m. Sometimes they will do with DEC provocation. DEC, they will administer 100 milligram, and after 1 hour, the microfilaria concentration will be more in the blood. So they take the blood after 1 hour of administration of DEC, that is 100 milligram administration. Then the next indicator here is the endemicity rate. Here the numerator is number of individuals carrying microfilaria in the peripheral blood, or number of persons having visible manifestations of the disease, or both. If suppose a person has any of those microfilaria, presence of microfilaria, or the presence of any of the visible symptoms, then that person will be included here for filarial endemicity rate. So endemicity means it is the presence of microfilaria and the disease. So that is the numerator here for filarial endemicity rate. For filarial disease rate, it is the number of persons showing the visible manifestations of the disease divided by total number of people examined into 100. So the filarial indicators are very simple. There are three commonly used indicators: microfilarial rate, endemicity rate, and disease rate. All have the denominator as number of people examined, number of people examined, and number of people examined with the multiplication factor 100. And the numerator for microfilaria is the presence of microfilaria in the peripheral blood, and for this people having visible manifestations, and for endemicity the numerator is people having the microfilaria or the visible manifestations of the disease, or both. So these people will be included in the numerator. Now we move on to the problem related to the filariasis indicators. Endemic town with 1.5 lakh population was surveyed for filaria in the year 2019, and some of the findings of the sample size 7,400 were given below. The person showing only microfilaria in blood is 310. The person showing clinical manifestation is 68. Those who showed microfilaria in the blood and also showed clinical manifestations of the filariasis was 9. Now we are asked to calculate the three common indicators of filaria, that is microfilarial rate, endemicity rate, and disease rate. We have kept the question here, and the answer key is here. If you want, you can check in the end. So we have three indicators, important indicators of filaria, that is microfilaria rate. We all know the denominator for all the parameters is the number of blood examined. So we keep this 7,400 as the total number of blood examined is given here as 7,400. So all the indicators will have the denominator as 7,400. The multiplication factor will be 100 for all. So we place this 100 here. Then the numerator is going to be the unknown factor, which we are going to find. For microfilaria, it is given here. The number of persons showing only microfilaria is 310. Here it is with clinical manifestation of filariasis 68, and here there are some 9 persons who have both microfilaria and clinical symptoms. So when microfilaria rate is asked, the numerator will be this 310 plus this 9. So when we do this, we get 319 divided by 74. So that will be 4.3%. Then the next parameter is the disease rate. For disease also, here it is given only clinical symptom is 68, and this 9% has shown both the symptoms and also the microfilaria. So we need to have the 68 plus 9. It is 77 divided by 74. So that is 1.04%. And when it comes to the filarial endemicity, we need to combine these all the microfilaria and the filariasis case. So for that, we need to add the only microfilaria, the only disease, and both symptom and the disease, that is 9. So when we add this, we get 387 divided by 74, which will give around 5.2%. So the significance of this prevalence of this indicator is when the microfilaria rate is more than 1%, WHO recommends mass drug administration of BEC and other measures to strongly control the disease. Here in the question, for calculation purpose, they have given the high values because they have mentioned it is an endemic town itself. So if suppose after this question, if a question is asked to interpret the result, then you need to give these recommendations, and you need to suggest the active survey and active control of the disease, and you need to suggest all the levels of prevention, primary, secondary prevention for the filariasis. So to summarize, in filariasis, we different set of parameters, that is clinical, entomological, and parasitological indicators for filarial disease control, out of which the parasitical parameters are the most important, and these three, that is microfilaria rate, disease rate, and endemicity, are the most important indicators which you need to remember and calculate. All the denominators are same, the number of people examined, And the multiplication factor for all the indicators is 100. And the numerator is also very simple. If we remember the terminologies, name of the terminologies correctly, then we can easily answer the filarial indicators problems. Hopefully, this video was useful to you. If you like this video, please click on the like button and share it to your friends. If you haven't subscribed to the channel, please subscribe. Thanks for watching.